Hello everyone, this is SHEELAM SRUJAN, a final year medical student in Government Medical College, Siddipet. In this video, let us know what are the second year books available for second year MBBS and also let us know how to learn second year. Let us now know about pathology. For pathology, we have gold standard like Robbins and Cotran. Also we have Ramadas Nayak and Ashmohan. For pathology, we have general pathology, hematology, and systemic pathology. Every one of us must build our concepts in general pathology from Robbins and Cotran. Because Robbins South Asian edition is really very good book to understand the concepts and build the base for systemic pathology. If you can't understand the general pathology concepts from the beginning in second year, it will be very difficult to understand systemic pathology. And general pathology from Robbins is okay to understand, okay to read. Initially, you might feel difficult to understand the language of the book, but you'll be habituated for that. And you have to get habituated for that. But because many of us must have compromised in first year, if you compromise from now also, there's no meaning in that, because from now on we'll be entering clinicals and you should be very active that you should read for treating patients, not for just passing the exams. So definitely start your general pathology and do well with Robbins. And for systemic pathology, then this volume 2, which is really heavy for systemic pathology, I suggest you to read Ramadas Nayak. Ramadas Nayak is like concised version of Robbins. So the same flowcharts for pathogenesis and same concepts will be there in Ramadas Nayak, and it doesn't make anything different from the language also. And it will be simplified version. So Ramadas Nayak is very sufficient for systemic pathology, and for hematology you can go for Robbins or Ramadas Nayak based on your feasibility. Also, we have Mohan, this Indian author book, which is also very good, but I did not personally use this book for my preparation. But this might not be so much essential if you are comfortable with Robbins and Ramadas Nayak. If you feel Robbins and Ramadas Nayak are not for you, you're not getting with the pace of the language, you just try Mohan, and if this feels easier, you can choose it. Let us now know how to learn pathology. Pathology should be understood in the headings like etiology, pathogenesis, clinical features, investigations, and treatment. Pathology means the study of suffering. So try to understand very well the pathogenesis and clinical features from very good textbooks like Robbins. We have Dr.Priti Sharma ma'am and Dr.Priyanka Sachdev ma'am to build the concepts of pathology. Also, in theory examinations, the questions are like gross and microscopy of particular disease. So try to concentrate more on that, and also understand the histopathology image, like some particular things will be there like owl eye appearance and all. In the first time you cannot see the starry sky appearance and all. So try to see for more number of times so that you'll easily understand, even if any image based questions or histopathology based questions are there in your MCQs. Let us now talk about microbiology. For microbiology, we have this very good book and the one and only book, the hero of microbiology, Apurba Sastry. Microbiology is studied under general microbiology, immunology, and systemic microbiology. See, every one of us will feel difficulty when we read laboratory diagnosis. Multiple revisions are necessary to remember laboratory diagnosis. But to understand what is there in the laboratory diagnosis in systemic pathology, one should know very well what is there in general microbiology. So try to understand very well when you are reading general bacteriology, general virology, general mycology, and general parasitology. In what word I mean, when you are reading the basics of microbiology, when you are reading and understanding general microbiology, try to understand the concepts well and understand under what headings are we describing any laboratory diagnosis. In microbiology also, microscopy, obviously microbiology has importance for microscopy. So try to understand the image well. Here also, as in pathology we have seen, here also we have, for example, Malassezia furfur has spaghetti and meatball appearance. If you look at the image multiple times only, you can identify it as spaghetti and meatball appearance when you look at the image after that in any exam. So have multiple revisions, read well. It's very volatile. Pathology and microbiology, both are volatile subjects, so multiple number of revisions are important. There are people who got distinctions in pathology, microbiology also. The only secret is repeated number of revisions. When you read it for the first time, you'll feel first year was better than this. Obviously, second year is difficult than first year. So try to start reading from the beginning, and try to read more number of times, revise more number of times, so that you'll understand and remember for more long time. And to understand the concepts, we have Dr.Priti Sharma ma'am. Let us now know about pharmacology. For pharmacology, we have gold standard in India. It's not gold standard, but in India, it's a very good book and big book, which is K.D. Tripathi. But I do not suggest you to buy K.D. Tripathi, and because with these huge books, to read Robbins and to read Apurba Sastry, to remember the concepts, it is very huge. I do not suggest you to buy K.D. Tripathi because it becomes burden for you to read all the three subjects from very big books. So it has good concepts, but it's not necessary to read K.D. Tripathi. Shanbagh is a very good book and sufficient for exams and also for your MCQs. Shanbagh is very useful, and which I have also used for my exams. So for understanding the concepts also it will be useful, but it will be in a concise version, and that's enough for us. To read classification, K.D. Tripathi is the one and only book. Every one of us must read K.D. Tripathi classification of pharmacology because this classification has more detailed and easy to understand. It's not easy to, there is nothing to understand, you just have to remember. So make mnemonics and try to read classification with friends, a group of friends, 2 or 3, or your roommates or your close friends, so that you'll remember when you make jokes and mnemonics while reading this, than reading alone and remembering only for yourself. So try to read classifications of drugs with your friends and make mnemonics, and if you, whatever the drugs you forget, whatever the classifications you forget frequently, make a stick notes. I used to have stick notes on my walls, so that every day I used to wake up and look at them, and I used to remember well. For pharmacology, we have Dr. Gobind Garg's videos. They are like beauty, with Gobind Garg's videos you can build the concepts, you can write exams. It's like Rajesh Jambulkar sir's videos and lecture notes for biochemistry in first year. So Dr.GRG sir's videos are the blessing for pharmacology. Try to go with that. I have suggested you these books, but try to read for a month in the beginning and try to know which book is suitable for you, because I might like Robbins, I might like Ramadas nayak, but you might like Mohan more. I might like Ramadas nayak for everything, but you might choose Robbins for general pathology. Like I said, everyone's mindset is different, understanding is different, so try to know which book is for you and go with that. And one thing which I wish I did this in second year, because second year is very important. My seniors have told me that second year is very important. Patho, Pharma, Micro will be combinedly there in surgery, medicine and pediatrics. But I did not concentrate so much in second year. So I really suggest you to not do that, and build your concepts very well in pathology, pharmacology and microbiology, because if you know them very well, it is a piece of cake for you to read medicine, surgery and pediatrics. Not OBG, because it's a different entity. For surgery, medicine and pediatrics, it will be very useful for you. So do not neglect second year subjects. They are the building blocks for your clinicals. Also, you will go to postings from second year. Utilize postings well. Do not feel that no one is coming to you and teaching like, come, this is the sign-in patient. No one will come and teach you in postings. You should go behind the doctors, you should go behind your seniors and ask your doubts. Also, when you know the thing, you'll see. There's a saying like, if your mind knows, then your eyes will see. So try to read pathology, microbiology, and then go to postings and then understand what is going on there. Then you'll know what is happening to the patient. Try to communicate with patients. Try to build a connection with the patient. Try to have empathy towards the patient. Take history taking well. Learn the clinical skills well. I'll do a special video for postings in the future. So try to stay tuned to the channel. Do share this video to your friends. Also like, comment and subscribe